Welcome to Dr. Martin, Head and Neck Radiology. This channel brings you clear and practical explanations of imaging findings in head and neck radiology. In today's video, we will review a classic case of a frontal sinus mucocele. We will go over the clinical background, the CT findings, and the most important points for diagnosis and management. Let's begin with the clinical scenario. This is an 80-year-old woman who came in with persistent frontal headache. To investigate the cause, her doctor ordered a non-contrast CT scan of the paranasal sinuses. Now, let's look at the images. We are reviewing an axial CT image in bone window. The scan shows that the left frontal sinus is completely filled with mucous material. The sinus is also expanded. It looks clearly larger than the right frontal sinus. The bony walls are thinner than usual, which is a sign of bone remodeling caused by pressure. Next, we examine the coronal reconstruction, also in bone window. Here, we can confirm the same findings. There is full opacification of the left frontal sinus by mucus content. There is visible expansion of the sinus compared to the right side. And the bony margins look scalloped and thin, which is typical of remodeling. To summarize, this patient shows three key findings: opacification, expansion, and bone remodeling of the left frontal sinus. Together, these are the classic CT features of a frontal sinus mucocele. Mucoceles are the most common expansal lesions of the paranasal sinuses. They are most often found in the frontal sinuses, followed by the ethmoid and maxillary sinuses. It's important to remember that a mucocele always causes expansion. If a sinus is filled with mucus but does not look enlarged, then it is likely a blocked sinus, not a mucocele. On CT, the key findings include complete opacification, sinus expansion, and thinning of the bone due to pressure. Unlike tumors, mucoceles do not erode the bone. They remodel it slowly over time. Other conditions can also cause opacification of the sinuses. These include tumors of the paranasal sinuses, retention cysts, sinonasal polyps, and chronic sinusitis. However, when you see all three findings, opacification, expansion, and remodeling, a mucocele should be your first consideration. Mucoceles happen when the drainage opening of a sinus gets blocked. This can occur due to inflammation, trauma, previous surgery, or tumors. As the mucus builds up, it slowly expands a sinus and causes pressure on nearby structures. Symptoms vary depending on the sinus involved. In many cases, patients may have pain, pressure, or even eye symptoms if the mucocele is near the orbit. Treatment is usually surgical. The goal is to open the blocked sinus and allow drainage. If you want to keep learning, I recommend our video on the CT findings of orbital blowout fractures. It covers key signs to recognize this injury and how to evaluate the orbit in trauma cases. You'll find the link in the video description. Thank you for watching this video. Recognizing the typical CT findings of a mucocele can help you make a confident diagnosis. If you found this content helpful, please subscribe to Dr. Martin, Head and Neck Radiology. We post new videos regularly, made for radiologists, ENT specialists, and healthcare professionals in training. See you in the next video.